Hi everybody, welcome again to Dr. Manny's YouTube Learnshops. What we'll be looking at today in this session is social and cultural issues that you may be exposed to in health, and this is part. The learning objectives for this session are to define health and illness and disease, explain selected models of health, review epidemiology in healthcare, and examine the dimensions of health. Also discuss the socio-cultural factors in healthcare. Let's look at the concept of health. Understanding health is the basis of all healthcare. If you don't understand what health is, or what it is to be healthy, then you won't understand the importance of healthcare. Because health, it isn't perceived the same way by all members of the community. And this includes biomedical scientists, social scientists, health administrators, ecologists, and other healthcare providers like nurses. And this makes the concept of health potentially confusing. Think about what the concept of health means to you as a member of society and as a healthcare provider. And it's interesting, and it's so true, that health isn't valued until you're sick. No one wants to be sick, and it's always someone else's fault. Health, as Thomas Fuller indicates here in his quote, is not valued until sickness comes. Let's look at some of the evolving health concepts. Health has evolved over centuries from an individual, I only care about myself perspective, to a worldwide social goal. Look at the current situation with COVID-19. It's a global pandemic. And I believe that we as a global community are supporting each other. Look at social media. Models in healthcare. Before we look at some of the models, it's important just to reflect. What's a model? A model is an ideal, that's what it is. We want to follow it. So a model, in this situation, is a theoretical way of understanding a concept or an idea. Models represent different ways of approaching complex issues. Nurses, many theorists, have developed various health models to provide effective healthcare. And healthcare models then allow nurses to understand and predict patient healthcare behaviours. Some of the models of health that we'll be looking at are the biomedical model, the socio-ecological model, the biopsychosocial health model, the holistic health model, the holistic nursing health model, and finally the health and illness continuum model. Let's look at the biomedical model. Traditionally, health has been considered as an absence of disease. If a person was free of the disease, they were considered healthy. And this is based on the germ theory of disease, which Louis Pasteur professed in 1857. Germs are the reason we get an infection. When we get an infection, we get signs and symptoms, we follow a certain course, and we need treatment. In the biomedical model of health, health meant, as I said, an absence of disease. The human body was seen as a machine. Disease was considered the breakdown of the machine. One medical task was to repair the broken or damaged machine. And this has minimised the position of environment, social and culture in health, which means, in the biomedical model, environment, social aspects and culture were not considered as important in health. The biomedical model of health, it focuses purely on biological factors, physiology, pathology and biochemistry, and excludes psychological, environmental and social influences. And that was something that was focused on in my day when I first started nursing. Developments in medical and social sciences concluded that this model, however, was inadequate. It didn't meet the needs to assist health and healthcare. Here's an example of the biomedical model of health. The incidence of stroke and the relationship to smoking. See, this is a cause and effect. This is a quantitative type of methodology, which again is very scientific. And it focuses on the pathophysiology of cardiovascular disease and the medical treatment. Look at the sign. Cigarettes cause strokes. Warning. Tobacco smoke can cause the arteries in your brain to clog. This can block the blood vessels and cause a stroke. A stroke can cause disability and death. I find it interesting, even today, when you look at the cigarette packets, they have terrible pictures of now heart disease, cancer, etc. But it doesn't deter people from smoking. Let's review what the social ecological model of health represents. In this model, it emphasises multiple levels of influence, such as the individual, which reflects knowledge, attitude and skills. It looks at interpersonal, which is the person's social network, who they interact with. It looks at the organisation, so this is the environment and the ethos from which you come from. The community, which is your cultural values, your norms, and public policy. What pertains to the general public. And it's the idea that behaviours both shape and are shaped by the social environment. That's the emphasis of this model. Here's an example of the social ecological model. Obesity in developed countries requires more attention towards examining and improving health promotion in communities, and therefore reducing the common selection of high-calorie, high-fat food choices. Ecology is to do with the environment, the social environment, as well as the physical environment. Malaysia currently has the highest obesity record in the Southeast Asian community. The next model is the biopsychosocial model of health. And it defines health as a state of complete physical, mental and social well-being. Physical being the biological, physical health, disabilities, genetic vulnerabilities and exposure. Mental health being psychological. So these are beliefs, attitudes, your self-esteem, your coping skills, your social skills, and also the social aspects, which are related to your peers, family, circumstances, and work-related issues. And these are influenced by all these aspects related to social, psychological, cultural, economic, and political factors. An example of biopsychosocial health, well, it can be a biological condition, a physical condition, such as you've injured yourself in the workplace. And as a consequence of that, you've got a lot of pain. And because you've got a lot of pain, you need pain management. And then if your social circle encourages the use of these painkillers, and it encourages the excessive use of these painkillers, then this could easily result in life-changing habits, which could result in drug addiction, as an example. Let's look at the holistic model of health. And in this model, holistic, we're looking at everything as a whole. The emphasis is on promotion and protection of health, and it's multidimensional. It involves the well-being of the person as a whole. Their emotional aspects, physical aspects, spiritual aspects, social aspects, financial, intellectual, occupational, and environmental. And this encompasses all the things or aspects that are related to being well, wellness. It recognizes the strength of social, economic, political, and environmental influences which all have an effect on health. Consider, think. Can you think of examples for the application of the holistic model of health in the following medical conditions? You've had a stroke. Gee, just think about it. You've had a stroke, or a family member has had a stroke. This is going to impact on your emotional state and their emotional state. It's certainly going to have an effect on their physical characteristics. They may not be able to walk. They may not be able to feed themselves. Think of it from a financial point of view. You, here in Malaysia, they're going to need aids. This is going to cost money. They're probably going to develop other conditions in relation to the stroke. I mean, they may develop a pressure ulcer because they can't move. It's going to cost money. Intellectually, it may have an effect. Occupationally, they may lose their employment. Environmentally, you may have to change the physical environment of your home. Ramps, rails. Socially, in most countries, as we've discussed previously, there's a stigma towards disabled people. So spiritually, I guess God is going to be a very important aspect of their life to encourage a positive attitude. The same could apply to having a heart attack or having a mental health issue like depression, or having a chronic lung condition such as emphysema, or whatever you decide is related to this holistic model of health. The impact of being unwell or having any health-related condition has a severe impact on your life and encompasses a lot of aspects which is being referred to here as in the holistic model. You've got to consider all these things. when your health is affected. Let's look at holistic nursing, the health model. And this model is defined as all nursing practices that have a healing effect on the whole person. That's the goal. And this leads the nurse to being more aware of the patient, the interconnectedness of self, others, nature, spirit and relationships that should promote optimal health. And these can be put into 4 main areas, such as the physical, the intellectual, the emotional, and the spiritual relationships that interconnect and provide holistic care. In this model, nurses that use the nursing process consider patients to be the ultimate experts concerning their health. They're advocates and they respect the patient's experiences, especially their subjective experiences, which are relevant in maintaining and assisting their healing process. Patients are involved in the process and they assume some responsibility for health maintenance. Let's review, think about it, reflect on what you remember as the nursing process. And this term, nursing process, is widely accepted and is designated 5 typical steps that the nurse takes in planning and giving nursing care. The steps are primarily assessment, diagnosis, outcomes and planning, which is interconnected, implementation, and evaluation. And after evaluation, there's reassessment and the whole process begins again. It's a cyclic process. In this model of holism, nurses recognise the natural healing abilities of the body, and they also incorporate complementary and alternative types of interventions, which again are very much employed still here in Malaysia. Not by the nursing fraternity, but certainly by providers outside of the nursing fraternity. And you can include in this holistic model such interventions as music therapy, relaxation therapy, aromatherapy, therapeutic touch, and guided imagery. Think about it. Where could you use music therapy in your practice or your future practice? Where could you use relaxation therapy or aromatherapy or guided imagery therapy or breathing exercises? Well, consider, from my experience, music therapy used in the operating room keeps the surgeons calm. They don't get too hypertensive. They don't throw around equipment. In the intensive care, music therapy is very stress-free related. Relaxation therapy, any painful procedures that are performed. Aromatherapy in stressful areas. Coronary care units that I've worked in, some intensive cares that I've worked in, aromatherapy is very relaxing. Guided imagery, which means nice pictures. There are nice pictures on the wall. They can be in long-term stay wards. We've employed them in paediatric units to make them nice, to make them comfortable, to make them feel not so away from home. Intensive cares. intensive cares, very technical areas. So nice pictures, images of gardens, flowers, the ocean, etc. could be used. Breathing exercises. Well, in the labour and delivery suite. Now let's review health and illness as concepts. Health and illness, they're not static conditions. They're constantly in motion. And they're subject to continuous evaluation and change as a healthcare or as a health continuum. And typically you've got the continuum being that in the centre, you're healthy. Well, you don't have any illness. You may not be healthy, you may have a condition, but you're not sick. You may, for example, have heart failure, but with the treatment that you're having, you're not really sick. You're considered healthy, despite having a condition of ill health. There's no illness present. So you can move either way. You can move along the continuum to good health, to optimum health. Or you can become ill with a debilitating illness which results in a premature death. Health, according to the World Health Organization, in 1948 made the statement that health is a state of complete physical, mental, and social well-being, not merely the absence of infirmity and disease. Interestingly, which was advocated by the Biomedical model. Health involves emotional and psychological wellness, not just efficient and properly functioning of the body as a machine. Wellness, defined in 2020, is an active process of becoming aware and making choices towards healthy and a fulfilling life. And it incorporates physical aspects, psychological aspects, which include mental and emotional aspects. It involves the environment, social interaction, and your spiritual support and beliefs. What are the dimensions of health according to the World Health Organization? They state, well, the dimensions of health from a holistic point of view incorporate the physical, the emotional, the spiritual, the intellectual, the environment, and social aspects. Physical relates to good nutrition, regular exercise, avoiding harmful habits like alcohol, smoking, drug abuse, and if you do have a problem, seek medical assistance as soon as possible or as required. The dimension of health that relates to emotional well-being is to understand yourself, reflect, understand your own feelings, accept that you're not perfect, accept your limitations, and try and achieve emotional comfort and stability. The spiritual dimension of health is really important as well, because it offers you a sense of purpose, moral and ethical values and beliefs. Morals give meaning to life. A person without morals is immoral. and essentially they're not a very happy person. Look at the intellectual. The intellectual aspects or dimensions of health involve the mind, which is engaged in learning, problem solving, and creativity within your world and the world around you. Learning is an ongoing process. You never stop learning. Challenge yourself. The environment is another dimension of health, and it reflects personal health, which depends on the health of the planet and hazard protection. So look after your environment. It always distresses me here in Kuching. I'm driving along and I look at the litter. I look at the filth. I look at how Sarawakkians who promote Sarawak are not very nice to their environment. The environment reflects personal health, not only of your planet, but also of you being on your planet, your environment. Then there's the final aspect which relates to the social. Your ability to relate effectively, kindly, nicely to others within and outside the family unit. They are all aspects that relate to health. What then is disease or illness? Disease is a physical or mental disturbance which involves symptoms, dysfunction or tissue damage, and usually causes sickness, which is illness. Though one can have a disease, as I indicated earlier, without being ill. You can have diabetes mellitus, but you're not sick. You can have a cardiac problem, but you're not sick. You're not ill. You can have a respiratory problem, but you're not sick. Illness, however, or sickness, is more a subjective concept and related to personal experiences of a disease. So it's how you perceive yourself. Because, for example, you may have cardiac disease, you may have a respiratory problem, but your attitude, your subjectiveness, doesn't relate it to being ill or sick. You continue to work. You continue to support your family. You may have a renal problem. You may have to have renal dialysis, but you perceive it as being part of your life. Yes, it's a disease, but from your perspective, a subjective perspective, is not an illness. Everybody is different. Illness relates to what you believe it to be. The disease is a professional or medical perspective. The sickness role is another aspect which we discussed in behavioural sciences, and this relates to societal perceptions of how you should behave. So, think about it. What do you know are common illnesses? Let's review. Common illnesses or sicknesses could be allergies. They could be a cold. They could be a flu. It could be a sore throat, ear pain, diarrhea, headaches, backaches, stomach aches, maybe a urinary tract infection, or conjunctivitis. There are some examples of common illnesses. What then are examples of diseases? Diseases are classified with certain categories. So, for example, infectious diseases, SARS, MERS, COVID-19. Influenza, the common cold, tuberculosis, hepatitis A and B. They're communicable. They can be transmitted. What are deficiency diseases? Well, they're deficiencies in something that you're missing. So typically, it could be things like osteoporosis, rickets, tetany, which relate to a calcium deficiency. But there are lots of deficient diseases. What about diseases that are genetic? Genetic diseases can be related to things like sickle cell anemia, cystic fibrosis, haemophilia. The list goes on and on. Physiological diseases, well, they relate to your physiology and result in a pathophysiology. This can be Alzheimer's disease, respiratory diseases like asthma, visual disturbances like glaucoma, diabetes mellitus. Diseases can also be classified in other ways, as we just mentioned, communicable or non-communicable. Well, communicable diseases are those that we just said: SARS, MERS, COVID-A, influenza, the cold, tuberculosis, hepatitis A and B, hepatitis C. They can be mumps or pertussis. The non-communicable are things related to heart disease, renal disease, lung disease, endocrine diseases, organs. Let's look at the epidemiology of disease. Well, what's epidemiology? It's a big word. Epidemiology is the method used to find the causes of health outcomes and diseases in populations. This is the etiology. What caused it? Etiology, cause, epidemiology. In epidemiology, the patient is the community. Individuals are viewed collectively, not just as one. What are the objectives of epidemiology? Well, as just indicated, it's to identify the etiology or the cause of the disease. Again, reflect back on COVID-19 and what transpired in China. Epidemiology as an objective is also to determine the extent of the disease, to study the progression of the disease, to evaluate preventative and therapeutic measures for the disease or condition, and then to develop a public health policy, which again we are all in the process of currently in view of the pandemic related to the COVID-19 of 2020. There are typically 5 W's associated with epidemiology. What, who, where, when, why. The what is diagnosis or the health event. What was it? The who is who did it affect? The person. The where is, where did it happen? The place. The when is, the time. When was it timed? When was the time that it happened? The why or how are the causes, the risk factors, the modes of the transmission of the event. Let's look at the 5 W's in a COVID-19 situation. This is the example. So what was it? COVID-19. Who did it affect? The people of China initially. Where did it happen? In Wuhan, in the Hubei province. When did it begin? Approximately the 31st of December 2019. Why, how? Suspected from wholesale food market, transmitted by droplets or contact in relation to organisms carried by different types of animal species that are not domestic. What are some of the risk factors that are related to epidemiology? A risk factor is something that increases a person's chances of developing a disease, essentially. What are some of the types of risk factors? Cigarette smoking, tobacco, drinking too much alcohol, unhealthy nutritional choices, sedentary lifestyle in relation to physical inactivity, spending too much time in the sun without proper protection, not having certain vaccinations which exposes you to certain organisms, unprotected sex which again exposes you to certain viruses. I'm not sure whether old age or becoming elderly is a potential risk factor. I'm not sure. But when you look at the COVID-19 situation, being elderly with comorbidities potentially was. Let's look at the risk factor categories. And the risk factor categories are causative, predictive, and contributory. So for example, a causative risk factor is smoking tobacco, which could cause lung cancer. Predictive relates to, well, in poverty, AIDS seems to be higher. Malaria seems to be higher. Tuberculosis seems to be higher. This is a predictive. If you have people living in poverty, then they are more likely to develop these conditions. Contributing. What contributes to certain disease processes? Well, a sedentary lifestyle contributes to cardiovascular disease. Contributing factors could be high intake of fat or cholesterol. Contributing could also be related to smoking, which could contribute to cardiovascular disease. They could be interrelated. When it comes to epidemiology, how do you prevent disease? According to the World Health Organization in 2018, there are 4 levels of disease prevention, which are referred to as primordial prevention, primary prevention, and secondary prevention, with a final one being tertiary prevention. Primordial is the prevention of the development of risk factors. Primary prevention relates to healthcare promotion. and that's specific protection. Secondary is related to early diagnosis, early treatment to prevent any complications occurring. Tertiary, well, the event's already happened. So therefore, there's a disability, there are limitations related to the disease, and then you have to go through rehabilitation. Prevention is better than cure, especially when something has no cure. I mean, if you develop AIDS, well, eventually it will have an effect and eventually it will shorten your life. If you damage your heart because of unhealthy practices, well, there's no cure. Sure, you can have heart surgery. Gee, you can even have a heart transplant. But the condition will remain. So, take the point, prevention is better than cure, especially when there is no cure. Let's look at primordial prevention. Primordial relates to new concepts to prevent the development of risk factors. This is before. So, lifestyle modification. And it's tough. People don't like lifestyle modification. They want to smoke. They want to eat unhealthy foods. I do. I love KFC. I love Big Macs. I love Kabsa. I love the Malaysian foods. I love Indian food. But it's got a lot of things in it to promote ill health. For example, high cholesterol, high fat, lifestyle modification. You're looking at food, habits, smoking, doing exercise, alternative therapies, naturopathy, maybe considering Chinese medicine, relaxation therapies like yoga. Risk factors increase the risk for disease. But as we've mentioned previously, human beings, human nature advocates here now the thinking that it's not going to happen to you. But risk factors can promote bad things. Protective factors prevent or minimize disease. So, exercise, eat healthy, control your weight, control your cholesterol, control your blood pressure, listen to your doctors and be compliant with your medications. Primary prevention relates to healthcare promotion. You're looking at education, nutritional interventions, lifestyle behavioural changes, regular exercise. You're looking at specific procedures, immunisation, which is proven to be effective, pollution-free environment, noise control, chemoprophylaxis, which means taking medications, nutritional supplements, which may be beneficial. Look at the healthcare promotion here from the World Health Organization in relation to immunisation and potentially immunisation for COVID-19. Primary prevention primarily relates to healthcare promotion. Secondary prevention is related to, well, look, if you've got a problem, get an early diagnosis, get treatment for it, prevent complications. For example, if you're an adult who's having chest pain, go and see a doctor. Get the condition diagnosed. go onto the appropriate treatment medications, and that way possibly you'll avoid the complications that relate to decreased cardiac output, which will affect other organs, and it may prolong your life. Secondary prevention relates to regular health checks. For children, because they're an at-risk population, the elderly, which are an at-risk population, and pregnant women, which are an at-risk population. The higher risk groups are those who are obese, morbidly obese, even worse, smokers, alcoholics, and those who participate in a sedentary lifestyle. Tertiary prevention basically means, well, you have the disability, there are limitations associated with it, so therefore advocate rehabilitation. However, this is depending on the nature and the extent of the disability, which could be related to both or either physical or mental challenges. And the objective of tertiary prevention is to promote productivity, improve mobility, have physical therapy, do exercise, be engaged in occupational therapy, and have corrective surgery if it's required. So, for example, if you have had a stroke, instead of sitting at home moaning and groaning about how life is unfair and how God hasn't really been there for you, be positive. God gave you a brain, God gave you motivation, utilize it. Promote productivity. Just because you've had a stroke doesn't mean that you can't be productive. Just because you've had a stroke doesn't mean that you can't improve your mobility. Well, you can't improve it if you're sitting at home moaning and groaning about how unfair life has been and that you're depressed. Be involved in physical therapy. I mean, it doesn't mean that you have to go to a hospital and have a healthcare provider provide you with physical therapy from a physical therapist. Try and go for a walk. Try and move around. The more you do, the more strength you'll obtain, and you can do more. This means be involved with exercise. Occupational therapy. Do things. That's the important thing. Corrective surgery, well, I'm not sure it relates to stroke, but corrective surgery can be involved in maybe injuries that you've had. For example, you may have been involved in a motor vehicle accident. And as a consequence of that, maybe you lost your leg. So the surgery that was now corrective can be involved in occupational or physical therapies which give you an artificial limb, for example, so that then you can walk more effectively than just sitting in a wheelchair. Let's look at some of the current communicable diseases that are around globally. We're looking at SARS-CoV-2, sudden acute respiratory syndrome. This is COVID-19, which we've all been affected by. Tuberculosis. It's around. It's in Malaysia. It's in developing countries. It's reoccurring in some of the developed countries. Sexually transmitted diseases. Problematic in all countries. Chlamydia, human papillomavirus, syphilis, HIV, gonorrhea, pubic lice, trichomoniasis, herpes, simplex and zoster, hepatitis B, HIV we've already mentioned, We're looking at hand, foot, and mouth disease, especially problematic in children. We're looking at Middle Eastern respiratory syndrome, coronavirus A. In general, just the sudden acute respiratory syndromes related to their viruses. Bird flu, H5N1. Swine flu, H1N1. Global problems. What are some of the diseases in Malaysia? Common infectious diseases, communicable diseases, are dengue fever. Tuberculosis, still problematic. Hand, foot, mouth disease. Food poisoning, I've highlighted it there because, I like to eat at the restaurants on the street, but I can tell you, if you go to the evidence-based research in relation to Kuching in Sarawak, food poisoning, salmonella, is an issue. People that provide food to the general population are not very health care conscious. Viral hepatitis is still an issue. Other communicable diseases include measles, leptospirosis, malaria, Japanese encephalitis, typhoid. What would you do as a healthcare provider in offering advice? How do you prevent the spread of disease? It's interesting. With the COVID-19 pandemic here in Malaysia and globally, we're doing what we should have always been doing. It's called Universal Precautions. Using personal protective equipment effectively. And it's been brought to the forefront because of the terrible situation that we're all experiencing worldwide in relation to COVID-19. Use universal precautions. Do you know what they are? Universal precautions. Think of hand hygiene. You always are supposed to practice hand hygiene. When? When are you supposed to practice it? Look at some of the people that prepare food at these restaurants, even in McDonald's, even at some of the markets. It's scary. Preventing disease, vaccinations, compliance. People are not compliant. Why? Using antibiotics wisely. What exactly does that mean? When people go to the doctor with a cold, they expect to be given antibiotics, which is why we're in a current stage now here in the world where we've got organisms that don't respond to antibiotics, and we need greater strength antibiotics, which will eventually create an increased resistance to them. You're supposed to stay at home if you're not well. You stay at home if you've got signs and symptoms of infection. Why? Why is that recommended? Be smart about food preparation. What does that mean? Disinfect your residence, which are considered hot zones. What are hot zones? Practice safe sex. Why? How do you do that? Don't share personal items, such as your hair accessories, your tooth accessories, your food. Travel wisely. Don't fly when you're ill. Why is that? This is how you prevent the spread of disease. These are all the recommendations that are currently being advocated. These are all things really we should have been doing. So let's review again. What are universal precautions? Universal precautions are pretty straightforward. Hand hygiene. Wash your hands. Use gel. This decreases the risk of transmitting infections. Physical isolation. Well, it doesn't really mean that you physically isolate. It basically means that you don't share equipment. So, for example, if you're a nurse and you're going from patient to patient, make sure that you've cleaned your stethoscope. Make sure that you've washed your hands before you touch the next patient. Universal precautions. Use of personal protective equipment correctly. Always practice hand hygiene. When? Remember the 5 moments of hand hygiene. Vaccination compliance. Why? Because if you don't vaccinate when you're supposed to, then certain diseases will return, like tuberculosis, polio, myelitis. There have been cases in the Philippines, in the United States, that are returning. Use antibiotics wisely. Well, what does that mean? Well, there's no point taking antibiotics for viruses. You're going to have to treat that situation with your own immunity. As I indicated, antibiotics to treat diseases or infections that occurred 10 years ago are requiring much, much stronger antibiotics. And with every evolution of the virus or the bacteria, they evolve, they become stronger. Stay at home if you've got signs and symptoms of an infection. Why? Well, why do you want to transmit it to your colleagues at work? Why do you want to transmit them to the patients in your care? They already are immunocompromised. Any patient that is sick is already immunocompromised. And if they're young or old, they're even more compromised. Because when you're young, your immune system isn't effective because it's evolving. When you're old, your immunity is leaving you. Be smart about food preparation. What does that mean? Well, in the home, if you're preparing food, make sure that you've washed your hands. If you're now providing food to the general public, make sure that your hands are clean before you prepare the food. Make sure that your food is clean and it's been cooked properly. Disinfect your residence. Hot zones, what are they? Well, these are areas that are now potentially hazardous for people because of uncleanliness. Practice safer sex. If you're going to have sex and you've got multi-partners, well, you've got to protect yourself and them. Safe sex means be cautious, use protective devices. My advice is don't be promiscuous. Don't share personal items. What does that mean? In a community like Malaysia, you share food and people double dip. So their transmission of their body fluid into the food, saliva, can be potentially problematic and hazardous to you. Personally, I don't share food unless it's my family. My immediate family, which means my wife and my children. Travel wisely. Don't fly when you're sick. Why? An aeroplane is the greatest source of infection transmission. Because of the air conditioning, it's a closed environment, it's not open. If you don't have to travel, don't travel when you're not well, because you can infect other people. Now, let's look at what they call the health illness continuum. The health illness continuum, it's a process of change where individuals experience various states of health that fluctuate throughout their lives. Human beings have to continually adapt to change in their lives in order to maintain good health and well-being. It's a response to change rather than the change itself that affects the health. Let's look at the health illness continuum, which was recommended by and advocated by Travis in 1972, a medical doctor. And he basically said, if a person has a positive optimistic attitude to their health status, they'll probably have a high level of wellness, which is indicated by the blue arrow towards the right. If a person has a negative pessimistic attitude to their health status, well, this can lead to disability, symptoms, and probably a premature death. The neutral point is the middle. There's the health illness continuum, and it's the student with the positive attitude that is at the high level wellness continuum, the blue arrow. The other student who irrationally panics, stresses, doesn't do anything in a positive way is at the other continuum. Let's look at the impact of disease and illness on health. Well, the impact can relate to behavioural changes. And we're looking at people's reactions to the illness. And it depends. It depends on the nature of the illness, how long and how severe it's been. You're looking at the person's attitude towards the illness. Is it positive or is it negative? And you're looking at other people's reactions to the person's illness, because this can have an effect on how you are being perceived and how you perceive yourself. People want to be seen as positive, good in other people's eyes. So, for example, you've got a life-threatening illness that can lead to extensive emotional, behavioural changes and promote anxiety, depression, shock, denial, anger, withdrawal from family, society, from yourself. Look at the effect of body image. Body image is how you perceive yourself. Simply, it's the subjective concepts of physical appearance, according to Potter and Perry. But basically what that means is what you see is what you believe, or what you believe is what you see. Look at the image that we're looking at here. You've got old Joe, and he's looking in the mirror, and all he sees is positive things. On the other hand, you've had radical surgery for breast cancer. You've got terrible scars. You're a female. Your perception of body image can be negative or positive, and in most cases it probably will be negative. I'm just assuming. I'm not a female. I've not had a mastectomy. Look at the impact on family. When illness occurs, the person and their family roles may change. The provider may have to be not the provider. The person who wasn't providing may have to become the provider. The change may be slight, it could be huge, based on the severity and the duration of the disease. Dependents and family have to have coping strategies. Look at socio-cultural factors in healthcare. To be an effective healthcare provider, you've got to understand how people think about health, how they think about illness. You've got to understand behaviours and habits that influence health and healthcare practices. You've got to understand how actions are perceived by the community and how culture, environment, the economy, politics affect health and healthcare. From a socio-cultural perspective, look, it examines healthcare behaviours and symptoms in the context of patients' culture and their background. Clinicians using this approach integrate cultural and religious beliefs into therapeutic healthcare processes. The patient is the most important. The healthcare provider is an advocate and promotes the patient's healthcare needs. Look at sociocultural factors in health. We're talking about physical health, occupation, housing, family structure. In physical health, you're looking at lifestyle. What's their lifestyle? Are they smokers? What's their diet like? Do they have physical activity? Do they take alcohol? Are they using drugs? In their occupation, you're looking about whether they're employed or unemployed. What are occupational hazards related to their unemployment? You're looking at the housing situation. Are they living in a state of poverty? Do they have hygienic practices? Look at the family structure. It's a changing structure. You have an aging population globally. Attention to the young is important. Look at exposure and vulnerability as a socio-cultural influence on health. You're looking at disease. You're looking at risk-taking behaviours. You're looking at promotion of healthcare efforts. Are they effective? You're assessing healthcare. You're looking at whether healthcare is available. You're looking at access and availability of quality health care. Not everybody has access to it. The social factors for health, the indicators that classify groups of people in a given society. This relates to education. It relates to their income. It relates to their occupation, their ethnicity and race. You're looking at religious factors, political affiliations, their geographic location. All are factors that relate to health. Think about this. When you were a kid, as a child, you became sick, if you can remember, or you can remember aspects related to it. What was your family's view about taking care of you? Think about your mother, think about your father, think about your grandparents. What did they think in relation to taking care of you? What did they consider foods that were good for you? What did they think about when you had a fever, and how did they treat it? What was considered sick enough not to go to school? You. When you were sick, what was considered sick enough not to send you to school? What were your family's views about going to the doctor? Think about something related to your health when you were growing up, and then think about it. Did it change when you commenced nursing as a career? Let's look at some of the social inequalities related to health and healthcare. Culture and social well-being are not the same. There are so many cultures within a society, especially Malaysia. There are many social inequalities that are related to culture. For example, all human beings share a need for food, clothing, shelter. They don't want to live in a violent situation. They want non-violence and they want social justice. People want to feel loved and cared for. So therefore, access to these needs impacts on health. Remember Maslow's hierarchy of needs. Think about this. Do Malaysians delay or avoid seeking healthcare or medical treatment? Yes, maybe, no. Think about it. What are some of the indecisions about healthcare? What are reasons for delay in most generic populations? There could be a phobia to healthcare. You could be poor, no money. It's inaccessible. You've got beliefs about certain things related to healthcare that are different to the standard or general or accepted or the Western type philosophy. There's no time. It could be as a result of significant others' beliefs. Your mother, your father, your sister, your brother, your grandfather, your grandparents. You could have self-doubts about healthcare. Other factors could include your age, your gender, your genetic makeup. These all influence how you react to healthcare. What are some of the social healthcare issues? What about the care of the mentally ill? Issues of concern are social stigma, having a negative self-image, having low self-esteem. It relates to economic disadvantages and low levels of education. Unemployment or insecure employment related to mental health. And as we've discussed previously, discrimination and violence. What's some of the impact on these issues? The impact can be related to alcohol and substance misuse or abuse, or gender-based violence. Management relates to providing sensitive, patient-centered care and consultation with knowledgeable mental health professionals, which are both medical and nursing. What about the care for the chronically ill? What are the issues of concern? Well, chronic disease affects every aspect of a person's life. Every aspect. And the impact is on physical and mental health, family and social life, finances and employment, and this can lead to shortening a person's life. Management focuses on very similar issues which we've just discussed. Diagnosis and treated fairly and properly, providing sensitive, patient-centered care, and consulting healthcare professionals. With the care of the elderly, the issues of concern are they do have comorbidities. They have chronic illnesses, dementia, which you can refer to as Alzheimer's, hearing impairment, defective vision, hypertension, diabetes mellitus, respiratory diseases, heart disease, osteoarthritis. They can have gout. What's the impact? Loneliness, feeling demoralized, feeling disgraced, feeling degraded. How can we manage these issues? Provide a positive environment, provide social interaction, provide patient-centered care in consultation with knowledgeable healthcare professionals that care. What about care in end of life? The issues of concern relate to moral, ethical and legal dilemmas regarding a person's vital physiological functions. What's their prognosis? What's their quality of life going to be? Their personal values and beliefs are important. What's the impact in end of life? Well, essentially it'll be the fear of the unknown. Are they going to suffer? Are they going to have pain? What's going to happen to their relatives? Who's going to care for them? If you're a father, you care about your children. What happens after they die, after death? Management relates to 4 primary areas: physical comfort, their emotional and mental needs, their spiritual issues, and practical tasks that have to be performed after. Think about this. Have any of you ever been a patient or had a family member or a friend that was a patient? If the answer is yes, think about a positive experience or think about a negative experience. Or think about something that was potentially positive or think about something that was negative as a patient experience. Think about it. Do people really want to be a patient? Do people really want to be admitted to a hospital? Forget explaining. Think about it. Reflect on it. What's your role as a nurse in healthcare? The primary role of a nurse is to be a patient advocate and to care for individuals of all ethnic origins, religious backgrounds, and support them through their illness or why they've been admitted to hospital. As a nurse, you're responsible for holistic care. Physical, psychosocial, developmental, cultural, emotional, and spiritual. You're addressing these needs. That's what's important in your role being a nurse. Care about your patient, because that patient may be you one day. What are your responsibilities as a nurse? Again, first and foremost, you're an advocate for the health and well-being of the patient. You're to provide support and advice to the patients. Your role is to educate the patients about the management of their illness. Your responsibility is to monitor patient health and record data accurately. Record medical history and symptoms. Administer medications and treatments. Don't make medication errors. Operate medical equipment that you've been taught that you're competent in effectively. Perform diagnostic tests that you are credentialed to perform. And then collaborate with the team, the multidisciplinary team, to plan effective patient care. their nursing responsibilities. Let's conclude and summarise. Health involves emotional and psychological wellness, not just the biomedical model, which treats the body as a machine. Sure, machines break down, but a human being is not a machine. We look at the dimensions of health, and they encompass the physical, emotional, spiritual, intellectual, environmental, and social components. Holistic nursing utilises all nursing practices that has a healing effect on the whole person as its goal. The epidemiology identifies the cause or the etiology of the disease and evaluates preventative and therapeutic measures for a disease. There are social and cultural perspectives that examine healthcare. These relate to behaviours and symptoms in the context of the patient's culture and their background. But remember, always remember, the primary role of a nurse is to be a patient advocate. As stated by the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. Thanks everybody. That's the end of this session. If you've enjoyed it, please recommend it to your colleagues, your friends, and check out some of the other Dr. Manny Learnshops on YouTube. Bye for now.